Hello everyone, welcome to my channel The Courageous Nurses. So today we are going to learn something different, something new, that is the diagnostic tools for eyes. So in this video we are going to just have a basic idea about the various tools we use for the diagnosis of the various kinds of diseases which happen in the eyes. So let's start. So these are the various diagnostic tools for your eyes. That is your direct ophthalmoscopy, indirect ophthalmoscopy, slit lamp examination, color vision testing, Amsler grid ultrasonography, optical coherence tomography, color fundus photography, fluorescence angiography, endocyanine green angiography, tonometry, perimetry testing. In this video, we are going to see each one of them. In direct ophthalmoscopy, we are going to use a direct ophthalmoscope, that is your handheld instrument with various plus and minus lenses. The lenses can be rotated into place, enabling the examiner to bring the cornea, lens and retina into focus sequentially. The examiner holds the ophthalmoscope in the right hand and uses the right eye to examine the patient's right eye. And the examiner switches to the left hand and left eye when examining the patient's left eye. During this examination, the room should be darkened and the patient's eye should be on the same level as the examiner's eye. The patient and the examiner should be comfortable and both should sound normally. The patient is given a target to gaze at and is encouraged to keep both eyes open and steady. The examiner mainly they look for intraretinal hemorrhages which may appear as red smudges, and if the patient has hypertension they may be somewhat flame shaped. Lipid may be present in the retina of patients with mainly diabetes. This lipid has a yellowish appearance. The examiner may also look for microaneurysms and also for macular degenerations. Coming to indirect ophthalmoscopy, the indirect ophthalmoscope, it is an instrument commonly used by the ophthalmologist to see large areas of your retina. Although it will be in an unmagnified state, it produces a very bright and intense light. The light source, it will be fixed in with a pair of binocular lenses mounted on the examiner's head. So the ophthalmoscope, it will be used with a handheld and there will be power of 20 diopter lens. Slit lamp examination. The slit lamp is a binocular microscope mounted on a table. This instrument enables the user to examine the eye with a magnification of 10 to 40 times the real image. The illumination can be varied from a broad to a narrow beam of light for different parts of the eye. For example, by varying the width and intensity of the light, the anterior chamber can be evaluated by changing the angle of the light. When a handheld contact lens is used with the slit lamp, the angle of the anterior chamber may be examined. Now we are going to read about color vision testing. The ability to differentiate colors has a dramatic effect on the activities of your daily living. For example, the inability to differentiate between red and green can compromise your traffic safety. Some careers, example commercial artist, photographer, airline pilot, electrician, may be close to people with significant color deficiencies. The photoreceptor cells responsible for color vision are the cones, and the greatest area of the color sensitivity is in the macula, the area of densest cone concentration. Color vision deficit can be inherited. For example, your red-green color deficiencies are inherited in an X-linked manner, affecting approximately 8% of men and 0.4% of your women. In case of your acquired color vision losses may be caused by medications, example your digitalis, or pathology, example your cataracts. So, because alteration in color vision sometimes indicates condition of the optic nerve, color vision testing is often performed in a neuro-ophthalmologic workup. The most common color vision test is performed using the Ishihara polychromatic plates. I repeat, Ishihara polychromatic plates. These plates are bound together in a booklet. On each plate of this booklet are dots of primary colors that are integrated into a background of secondary colors. The dots are arranged in simple patterns such as numbers of geometric shapes. Patients with diminished color vision may be unable to identify the hidden shapes. Patients with central vision condition, example, in your macular degeneration, have more difficulty identifying colors than those with peripheral vision condition, example, in your glaucoma, because central vision identifies your color. Now coming to your Emsler guide, the Emsler guide is a test often used for patients with macular problems such as macular degeneration. It consists of geometric grid of identical squares with a central fixation point. As you can see in the picture, there is a black point. The grid should be viewed by the patient wearing normal reading glasses. Each eye is tested separately. The patient is instructed to stare at the central fixation spot on the grid and report any distortion in the squares of the grid itself. You will see in the next slide that how there can be distortion, so you will understand it in a better way. For patients with macular problem, some of the squares may look faded or the lines may be wavy. Patients with age-related macular degeneration are commonly given these Emsler grids to take home. The patient is encouraged to check them frequently, as often as daily, to detect any early signs of distortion that may indicate the development of a new vascular choroidal membrane, an advanced stage of your macular degeneration characterized by the growth of abnormal choroidal vessels. So as you can see in the picture that there are different kind of distortion. As you can see, there is a fixed point, but there is waviness, there is removal of few boxes or few lines. So these are the kind of distortion which can be seen in the patients. Ultrasonography. So ultrasonography, it is a very basic procedure and it is a very common procedure in our day-to-day hospital life. Lesions in the globe or the orbit may not be directly visible and are evaluated by your ultrasonography. Ultrasonography is a valuable diagnostic technique, we all know, especially when the view of the retina is obscured by your opaque media such as your cataract or hemorrhage. Ultrasonography can be used to identify orbital tumors, retinal detachment, vitreous hemorrhage, and changes in tissue composition with minimal discomfort for the patient. In optical coherence tomography, it is a technology that involves low coherence interferometry. Light is used to evaluate retinal and macular diseases as well as anterior segment condition. This method is non-invasive and involves no physical contact with your eyes. Color fundus photography. Fundus photography is used to detect and document retinal lesions. The patient's pupils are widely dilated before the procedure. The resulting fundus photographs can be viewed stereotypically so that the elevations such as macular edema can be identified. Visual acuity is diminished for about 30 minutes as a result of retina bleaching by the intense flashing lights. Fluorescence angiography. In this, it evaluates clinically significant macular edema, documents macular capillary non-perfusion, and identifies retinal and choroidal new vascularization. What is that? That means there will be growth of abnormal new blood vessels. It is mainly seen in age-related condition. It is an invasive procedure in which fluorescence dye is injected, usually into an antecubital vein. Within 10 to 15 seconds, this dye can be seen coursing through the retinal vessels. Over a 10-minute period, serial black and white photographs are taken for the retinal vasculature, as you can see in the picture. The dye may impart a gold tone to the skin of some patients, and urine may turn deep yellow or orange, which we have to explain to the patient. This discoloration will usually disappear within 24 hours. Just like the fluorescence angiography, this is your indocyanine green angiography. It is mainly used to evaluate abnormalities in the choroidal vasculature, conditions often seen in your macular degeneration. This dye will be injected intravenously and multiple images will be captured using digital video angiography over a period of 30 seconds to 20 minutes. The dye is generally well tolerated, but some patients they experience nausea and vomiting. Allergic reactions are rare. However, indocyanine green angiography is contraindicated in patients with a history of iodide reactions. Tonometry. Tonometry measures your intraocular pressure by determining the pressure necessary to indent or flatten a small anterior area of the globe of the eye. Pressure is measured in millimeters and mercury. High readings indicate high pressure. Low readings indicate low pressure. The procedure is non-invasive and usually painless. A topical anesthetic eye drop is instilled in the lower conjunctival sac and the tonometer is then used to measure the intraocular pressure. Coming to the last topic, that is a perimetry testing. It evaluates the field of vision, a visual field in the area or extent of physical space visible to an eye in a given position. Its average extent is 65 degrees upward, 75 degrees downward, 60 degrees inward and 95 degrees outward when the eye is in the primary gaze. Visual field testing helps identify which parts of the patient's central and peripheral visual fields have useful vision. It is most helpful in detecting central scotomas, the blind areas in the visual field, which is mainly seen in your macular degeneration, and the peripheral field defects like in your glaucoma and retinitis pigmentosa. I hope this video was helpful to you. Do like, share and subscribe for more such videos. Thank you.